We will have Dr. Jarvis start first and make an address, and then followed up by Paul Boland to share news on their respective fronts. And then we will take your questions in the following order. ABC 7, Fox 22, it looks like TJ Tremble will be on the call. Bangor Daily News will go next with Charlie Ihacker. Brianna from WABI. I believe News Center Maine will be an observer today, and then we'll have Amy Brown from WERU to round out our list. So without further ado, I'll turn things over to Dr. Jarvis, who looks like he's ready to go. Dr. Jarvis, take it away, please, sir.
Thank you, and again, good afternoon, and thank you for joining us. I have a few comments to make, and then I'll turn it over to Paul Boland to make a few more. As of this morning, Northern Light Lab has completed 3,081 tests for COVID-19. Of these, 90 were positive. This is a relatively small number, but it just shows that we are doing the right thing within our community, that our social distancing, our hand washing, and other efforts are doing well to keep the spread low from those people who are critically ill. As of this morning, we are treating 9 patients who are tested positive for COVID-19 across our Northern Light facilities. Our staff continue to do a great job caring for these individuals, and we are confident and comfortable with our supply chain that we are giving them the needed resources to protect them as well as to protect our patients and staff. I did want to talk a little bit about the CDC recommendation for fabric face coverings. The recommendation is that when people are out and about in the community because they need to get out for urgent needs, that they should be wearing some form of a fabric face covering, and that could be a homemade mask, a scarf, or some other material to protect other individuals from you while you're wearing that mask, and so that's important for you. And it not only is important when you're out at the grocery store or in other situations, but it's equally as important as when you visit your healthcare provider, either at their office or with one of our healthcare facilities. And so we are strongly encouraging that both visitors and patients, when they come to our facilities, that they wear one of these fabric face coverings in order to limit the spread of the disease. As we know, there are asymptomatic individuals out there who are infectious but don't realize it because they do not have symptoms, and we want to limit that kind of spread. And with that, I'll turn it over to Mr. Paul Boland for his statement.
Thanks, Dr. Jarvis. Just a reminder of some of the things we've dealt with in the past in terms of being creative with our employees in terms of work assignments, retraining, et cetera. That continues and in good measure, and we've been very pleased with the volunteerism of our staff. Our staff are just tremendous, and I can't say enough positive about the reactions and support we've had from within our staff and also from the community. A lot of outpouring of community support for our healthcare workers throughout the system, throughout the state. One example, recently we have a young lady in Piscataquis County who took it upon herself to make some signs and share them as a thank you to healthcare workers in Piscataquis County at the healthcare locations there. And support like that from the community is really very helpful and inspiring for the entire healthcare community. And so certainly I want to thank the community for those kind words and tokens of support.
Thank you, Paul, and I want to thank the community as well. We've had many people reach out to all of our facilities to see what they can do to help our healthcare workers as they go through this pandemic. One of the things that you can do for your community is to go ahead and, if you have the wherewithal and capacity, to make one of those cloth masks. That would be something that would be wonderful for you to either use within your family or friends, or to donate to one of our healthcare facilities. And if you'd like more information on how you can create one of those masks or how you can donate to one of our facilities, please visit northernlighthealth.org. But again, any type of fabric face covering will work. And with that, we'll take some questions.
Okay, thank you very much, Dr. Jarvis and Paul. We'll start a line of questioning first with ABC 7 Fox 22. TJ, take it away.
Good afternoon, Dr. Jarvis.
Hi, TJ. How are you?
I'm well. You look well?
Good. I'm glad that I look well. My hair is getting longer, though, every time I speak to you guys.
I know the feeling. Anyway, first off, on the mask, there's some confusion on my part. The cloth masks that people are making, those are okay for average Joe to wear as far as protection, but not for healthcare workers in their conditions. Is that correct?
That is correct. So the kind of masks that we wear are protective two ways. They protect the patients from us, and they protect us from the patients. The cloth masks, which are not medical grade quality, what they do is they really protect us from each other. It is the wearer it's not the wearer who's being protected, it's everybody else is being protected from the wearer of that mask. And so that's the reason why the cloth is okay in that situation, but not appropriate for our healthcare workers. And we will try to avoid using anything like that with our healthcare workers as long as we can continue to use medical grade quality materials.
One other quick question before I have to be shut off here. The last couple of days we've heard a lot about phasing in lifting restrictions. What are your views on that?
So again, I think we need to follow the guidance of experts around the country and our leaders here in the state. And so at this time, I think it is still prudent as the governor's order to continue our stay at home. We have been seeing, steadily increased numbers of cases. We have 4 counties now in the state that are presumed to have community spread, meaning that the virus is out in our communities and people are contracting it from one another. And so we want to limit that as much as possible. I think that right now we really don't have a good answer as to when we can start turning back on the machine, so to speak. But it's still important for us to do all of those good things of social distancing, staying at home unless urgently needed to go out, washing our hands, cleaning our surfaces, and protecting each other.
Okay, well, thank you very much, TJ. I'd like to move on now to Bangor Daily News. Charlie, you're up.
Yep. Dr. Jarvis, thank you for doing this.
My pleasure, Charlie.
So I wanted to ask about the testing process that Northern Light is now using. Can you sort of walk me through the chain of events from when a sample's collected and then how it's shipped and where it's shipped for that testing?
Sure. So we can collect swabs at each of our facilities. And as you're aware, we have assessment sites scattered across the state as well, where somebody can go and get a swab after it's been recommended by a healthcare provider or one of our triage lines for them to do so. In both instances, those swabs and or collections that are done at our facilities are sent to Northern Light Lab, which is housed here at EMMC. And we process those in-house. There are some times when we work with our state for certain reasons where we ask the state to run some of those tests. But for the most part, for Northern Light and for our surrounding community, we are doing the testing in-house. And we do that for several of the partners in the Bangor community as well as in some of our other communities around the state.
Good. And then my second question is just following up. How has that, what were your facilities doing originally before you developed that in-house? Were you just kind of shipping everything down to Augusta, basically? Was that the original?
Yeah, so initially we were send things to the state. Initially during this pandemic, the state did not have the capabilities of running the test either, and so they were sent to federal CDC. Then the state was able to do things at the state level in Augusta in their lab, which was wonderful because that helped make the turnaround time better. But then when we were able to do things actually in-house within Northern Lights Lab, it's a game changer. We went from days down to a day turnaround to now we can have a turnaround within a few hours. for a test result, and that makes a world of difference. The number of suspected cases that we have within our inpatient facilities has gone down simply because we can get a negative test back in just a few hours, and so that keeps our numbers of suspected cases down and allows us to concentrate on those true positive cases.
And next up, we have WABI. WABI, I believe it's Amanda, right?
It's Brianna.
Brianna, I'm sorry.
That's okay.
Brianna, you're welcome.
Hi, Dr. Jarvis. Thanks for doing this. My first question is, what is being done for testing in Piscataqua County? I mean, it's kind of amazing that there's 0 confirmed cases there currently.
So again, remember that we're still, the majority of the testing that we're doing are on those tier 1 individuals, so those that are so sick that they need to be hospitalized, healthcare workers, first responders, and those living in congregate living situations like nursing homes, long-term care facilities, shelters, and the like. So there's that portion of it. And also the population density in Piscataqua County is low, and so they naturally do social distancing there, and so it may very well be that the amount of virus being spread in that particular county is low, and that people just haven't had the severity of illness that we would be testing them. That does not mean that there is not virus there, and that those people can stop doing social distancing and hand washing and all of those good things. It's important that they continue to do that, because we'd really love it if they can be the one county in the country that doesn't have a positive case. While the rest of our counties, we just wish our cases stay low.
That would be pretty amazing. The next question I have is, do you know how many people have gone through the Bass Park testing site?
I'm sorry, I don't have the answer to that. I can say that it's on a daily basis, it is very variable, the number of individuals that have used that site. Anywhere from a low of just a handful up to a high of well over 40. And so it really just depends on the particular daily need. In either case, we have the staffing and the resources in order to take care of our community as we need to. We find that particular process to be invaluable for the greater Bangor community, as we do with our assessment sites around the state.
Okay, I'm going to move on to Amy Brown next from WERU, but while I do that, looks like unless Dr. Jarvis has some really long-winded answers for WERU for Amy, we might have an opportunity to get a few more questions in. So
depends how challenging she is.
I'll go through the list once again, so if you have some questions, if you have a follow-up question, we can put it in the chat bar below, and I'll make sure to call on you again. For now, let's move on to Amy with WERU. So hold on, Amy. It didn't unclick, unmute. There you go.
I can't do it at the same time. Sorry about that. Thank you, Dr. Jarvis. I just wanted to see if you could review the process now for people coming to the hospital. I assume there's still a process by which they need to get a doctor's note if they're going to get tested. But what about people who think they may have some symptoms just showing up in the emergency room? Is that happening, and what's the process for folks that are in that situation, especially if they are starting to have some of the more severe symptoms like shortness of breath?
So certainly we want anyone who feels that they need to reach out to their healthcare provider or to one of our healthcare facilities that they do so. We should not be neglecting our own healthcare during this pandemic. We do ask that if at all possible to call ahead. So if you are having respiratory symptoms that need you to go to one of our emergency rooms or to a doctor's office, that if you call ahead so that we can be prepared for your arrival. We understand that may not be in all cases, but that would be important. If you were to come to one of our emergency rooms, the process would be no different than what we do at any other time, other than we are asking screening questions as you walk through the door to that way isolate those patients and mask them if appropriate. Though I will say that we are probably moving in the direction of masking patients as they come through, regardless of their symptoms, again, just so we can limit the spread. At that time, you would be assessed by one of our healthcare workers, whether that be a nurse or one of our providers, and then appropriately screened if necessary. And if we feel that it's appropriate to screen you for the virus of COVID-19, then we would do so.
Okay, thank you. And one of our listeners asked about how to get testing if they don't have a primary care provider to get a note from for the testing sites.
Sure. So Northern Light Health, in conjunction with our community partners, has set up a nurse triage line, and that number is readily available on our website, northernlighthealth.org. And we can also share that with you as well after this press briefing. And so that all you need to do is call that number. We do not require that you're a Northern Light patient or anything along those lines. We'll answer the phone for anybody. They will walk through some questions for you, depending on your symptoms and your medical history, may give you some advice over the phone, and certainly will recommend you to either go to one of our assessment facilities or to seek care elsewhere if it's appropriate.
Great, thank you.
Very welcome. Thank you for the questions.
Hey, TJ, do you have a follow-up question that you would like to ask?
I'm good, Chris, thank you.
Okay. Looks like WABI, Dr. Jarvis, posted one. I'm going to read it to you. That came from WABI. She put it in the text thread here, and it is, how many congregate care settings, nursing homes, etc. does Northern Light own and manage, and how are things being handled at those places?
So I may, do you know the exact number, Paul?
Not the joint ventures.
Yeah, so we have joint ventures with another company as far as those goes. We can get those numbers to you. I will tell you that we are very fortunate with Northern Light and our partner First Atlantic that those facilities have the resources and staff that they currently need. I will say that I speak to the leadership on a very regular basis, and that as a community we talk on a regular basis. We are particularly concerned about our long-term care facilities. The most vulnerable population are at those facilities, and we want to make sure that the residents of those facilities are well taken care of, as well as the staff. And so we have multiple conversations about that on a regular basis, but thankfully the ones that are in partnership with Northern Light Health are doing well at this time.
I just realized, Charlie, I skipped over you. Apologies. Did you have a follow-up question that you'd like to ask?
Sure. Yeah, I'm curious, Dr. Jarvis, if with the testing, the testing guidelines that have been in place for a few weeks now, if you foresee those being loosened at all in the coming weeks because there's more availability of testing.
So that's the key right there, is having the availability of testing. And until we can be sure that we can continue to take care of those Tier 1 needs, it makes us very difficult to loosen up the parameters. All of us wish we had more testing and that we could do more testing for a number of reasons, not the least of which is it will help us to better predict what our needs will be across the state. And so I will say that we have been able to increase the number of tests here at Northern Light, and hope that we in the next coming weeks will be able to do that even more so in order to test beyond that Tier 1 category. I think Paul Bolin had a comment that he needed to make.
Thanks, Dr. Jarvis. Just to piggyback on the response Dr. Jarvis had to an earlier question in terms of community support and the volunteerism of our employees. This has been a community support in terms of the healthcare community as well, and so there's been great partnership. For example, in the Greater Bangor area with Northern Light Eastern Maine Medical Center, St. Joseph Healthcare, Penobscot Community Healthcare, all working together along with our nursing homes and long-term care and rehabilitation facilities to help one another and support one another in this time. So it's been a great outreach and collaboration among all those organizations.